Hello, everyone. My name is Jack Collins, and I'm the Student Union convener for the College of Medicine, Nursing and Health Sciences here at NUIG. I have the pleasure of being joined this evening by Dr. Eoin MacDonncha, who many of the health unit, and he's here to discuss the UniCov study and answer questions submitted by NUIG students and staff for Project UniCov. So for those of you that don't know, UniCov is a pilot surveillance study to assist the detection of increased levels of COVID-19 across higher education institutes with the aim of facilitating the safe and sustainable opening of campuses. So it's to help protect ourselves, your colleagues and your housemates, your family and society more generally. And the study itself is a study to compare the different modalities on non-invasive COVID-19 testing, such as saliva, PCR, rapid antigen, and sewage monitoring. Now, Dr. MacDonncha will talk to us a bit more about this in detail. And it's a pleasure to have you here this evening, Dr. MacDonncha. Thanks for joining us. It's great to have you here. The first thing I wanted to ask you was just if you could sort of explain your role in the UniCov study as the clinical leader.
Yeah, no problem at all, Jack. And delighted to have the opportunity just to kind of explain a little bit about this very kind of valuable and important kind of piece of research that's going on our own campuses for both students and staff. So yeah, in terms of my role, I was contacted by Dr. Breda Smith, the Director of Public Health, and her team who were involved in setting up the research project. Obviously, because of the nature of the data that's being gathered in terms of personal details and clinical details in relation to testing and stuff like that, for the purposes of kind of data protection and confidentiality, that they would have needed kind of clinical input in terms of the security and management of that data. So we were approached just in relation to providing that facility in terms of hosting the data and monitoring the data on a daily basis and week-to-week basis. But obviously then, as part of the study, when people are undertaking or participating in it, they may develop symptoms. They may turn up a positive rapid antigen test and or a positive saliva test. And in such circumstances, obviously the clear gold standard is still the HSE nasopharyngeal PCR test. So they would contact us, participants who would develop symptoms or develop a positive test as part of the study, be directed towards our service, be that students or staff for the purposes of UniCov, so that we could assess their symptoms if they had symptoms, and also then arrange for them to be referred for a HSE test, and so that we could monitor and track the results of those tests as well, just for the purposes of the study.
Okay, very good. Yeah, no, because yeah, it's great to hear about your involvement in the study, because I suppose everyone would sort of know you from being in the student health unit and the great service that you provide there. So another aspect then that people were wondering was sort of what you liked most about your role in the UniCov project.
Yeah, I guess for me, I think what I like most is just I can appreciate, again, like the importance and value of this. Like last year, during the academic year, obviously there was a kind of a small number of minority students who would have been on campus for maybe labs, practical tutorials during semester one, and then everything changed to the remote aspects of teaching for semester two. In spite of that, we had outbreaks during semester one, kind of a moderately sized outbreak, maybe through end of September through into the beginning of November across those 6 or 7 weeks. And then we would have had a very significant outbreak, obviously, that probably reached national media in the months of maybe February into the beginning of March, where there was huge kind of spread. And again, like reflecting, like that was at a time when there was no on-campus teaching. So I guess the campus setting and people being involved in this research project, the key thing is that you're keeping the campus safe, and that is important, so that if people are going to pick up COVID, it is probably more likely that you'll pick it up in an off-campus setting. And then when you are coming on campus and mixing with the maybe 19,000 students and also maybe the 10,000 plus staff, that you have a lot of people there where they're even with the best efforts at maintaining public health guidance and hand hygiene and masks, that there's still always a risk of COVID. So we would see that there's huge value in, again, protecting yourself, protecting your colleagues, and protecting the staff, and protecting the public as well that are around the campus and around the college environs. And a lot of the either campus accommodation or the private residences that students might be staying in the areas around the campus and in Galway City, you'd have a lot of elderly population that live kind of side by side, that would use the same shops, post offices, etc. So there's huge value to this project. It's a feeder project. It's looking at ways of testing for COVID that are a bit more pleasant maybe than the HSE, the gold standard HSE PCR test, and it's going to be able to compare the kind of more pleasant, acceptable tests with the standard gold standard HSE test, and just see how effective it is at helping us to detect COVID and detect COVID as early as possible. So that's probably I think the importance of it and the value of it is what gives us the greatest satisfaction out of being involved in it, you know. And more than delighted to help out when we were asked to.
Yeah, right. And yeah, you'd mentioned the sort of how it's beneficial to the community and the students, and the sort of even the community around the students, the elderly populations that live here in Galway as well, and how hugely important that is. And I suppose, despite it being the early days in the study, do you think the involvement of the students here at NUI Galway in the study has been beneficial from a public health perspective?
It's probably early to say from a public health perspective, aside from, like, even though I think so far there are maybe over 400 students, students and staff. There are over 400 participants registered for the NUI Galway site. But even within that, and we've seen a huge expansion. Thankfully, it's great that we've had people volunteering, particularly in the last week or two. There's been a big jump in the numbers, but we still want to go a lot more. We want to get to 2,000. So that's why we really need everyone to kind of come on board if they can. But we have already seen a couple of people who are both vaccinated and who have showed up as positive tests. So there is value in helping to facilitate early detection, and I guess that's one of the values. The really valuable aspects of this study is that when you're doing your twice weekly tests, your rapid antigen test and your saliva test, be it for the 2 weeks, that one arm would be what they call a surveillance. So it'll be different groups that do 2 weeks at a time. And then the other arm is the serial testing. So some people will be randomly allocated to either the surveillance 2 weeks at a time, dipping in and dipping out, or it's the serial test where people will be doing these tests twice weekly for a series of 8 weeks. But the value really is in that, in terms of protecting from a public health perspective, and protecting people around you, is that these tests can hopefully facilitate in you picking up COVID before you become symptomatic. So that pre-symptomatic or asymptomatic phase. So some people will get infected with COVID and won't develop any symptoms, or will be so mild that they don't notice. Other people will develop COVID, but they will be infectious. And those people who are asymptomatic are still infectious. And then also people who go on to develop symptoms will be infectious before they develop symptoms, for a couple of days before. And that's that pre-symptomatic phase. But you're less infectious than when you develop symptoms. So if we can pick it up early, before you're coming in and mingling with people and at your highest level of infectivity, that has a huge knock-on effect to reducing the amount of spread that you would cause should you develop COVID. So if we can detect it early, so there's huge value. So as I say, you're protecting the campus population, students and staff, you're protecting the population around you. I think for students as well, any students who are thinking of, that during the course of the semester, they'll be traveling home at weekends. Again, there's a layer of security, an added layer of kind of security and reassurance that's provided by knowing that you're doing this twice weekly testing, both rapid antigen tests and saliva tests, in terms of protecting your own family and friends when you might be going home at weekends. So huge value from a public health perspective, both locally here in Galway, but also if you're going elsewhere in the country at weekends or visiting,
Yeah, absolutely. And that as you say, it's an extra layer of security, and that's something. I mean, I know there's students getting involved, and you mentioned those 400 students, which is great. But we want to have it there. We want to get up to 2,000, and you mentioned the benefit of having that extra level of security and being able to, go home with an extra bit of insurance there. When you go home, they have that bit of security. If there were students that were maybe thinking of getting involved, but they're a bit hesitant, and I know we've all heard about the study, but if there was a student there that was maybe thinking of getting involved, what would you say to them that are the main benefits of being involved in this study? What do you think that they could benefit from being involved in the UniCov study?
Yeah, well, I guess the main benefit again is that if you are going to detect COVID, that you'll know as early as possible. The knock-on benefit of that then is that you're less of a risk if you do develop COVID, because you're going to pick it up early. You're less of a risk to your housemates, to your friends, to your fellow students, the staff, and all the rest. From a kind of a broader kind of a moral and ethical perspective, you're participating in something that is going to inform the future development of testing systems and surveillance systems, for both maybe third level education sector, but also for the wider public maybe going forward, because COVID is not going to disappear in the next 6 months or a year. This is probably going to be with us for a couple of years, hopefully in a far less severe way than it has been in the last 18 months. But this type of surveillance is going to be a key part of us hopefully getting further and further back towards a more normal life. So, and you mentioned like that, why that's again why the number of participants is so important, because what this is looking to do is to test how acceptable in terms of tolerable the rapid antigen test, the saliva PCR test is for people to undertake if they're happy to do them, but also how effective they are at picking up COVID compared to the gold standard, the ultimate HSE PCR test. And for any study to be valid, and for the statistics that come for it to be valid, the greater the numbers you have, the greater the validity and reliability of the statistics you get out of it. So the more people who come on board, the greater the validity and reliability of the findings of this research will be, and that hopefully will be contributing to us getting back towards an overall better and safer society as quick as possible.
Yeah, and absolutely. And I think that's an important thing you mentioned about the sort of moral and sort of ethical sort of arguments for being involved in the study. And we've seen that, I suppose, throughout the pandemic with the sort of take up of, people wearing masks to protect others. And there has been that sense of sort of community and that moral and ethical thing of protecting each other. And I think that's a great reason for people to get involved in the study, is for that sort of the ethical reasons. I suppose in talking to a lot of students about the study, there's people were sort of saying, oh, well, I'm worried that, I got a PCR test before and, it was quite sore, the swab went really far up, and et cetera, et cetera. I suppose one of the important things I wanted to ask is there's a difference between the rapid antigen testing and the PCR testing. Could you explain that maybe to?
Yeah. I'll give an explanation about it, but I guess the key thing I definitely encourage people to, if they have any doubts in that regard, is just to visit the UniCov, unicov.org website, and on that website there's a video clip that explains what's involved in both the nasal rapid antigen test and also the collection of the saliva PCR test in the tube. But I said just the nasal rapid antigen test. So absolutely, I'd acknowledge, and any person would acknowledge that the nasal pharyngeal test is not a pleasant experience. But it is still the best test. It is by far and away the best test we have. But the rapid antigen test is also, it's a nasal test. So the nasopharyngeal, the pharyngeal refers to the throat. So that's why it does go back so far, because they literally are trying to test the nose and also the top aspect or back of the throat. The nasal rapid antigen test is literally just the front part of the nose, As I say, on both sides, there's a small little swab. It is literally like tickling the inside of the nose. It's not something that is unpleasant or uncomfortable really in any way. When students do that, so ideally what they're doing is and then the saliva test is collected in a small little tube, a specific tube. When students sign up, whether they're in the serial testing for 8 weeks or the surveillance testing, they just get a 2-week pack at a time, and they collect it from the volunteer desks or the nominated positions on campus, we'll say. And they'll get 2 weeks worth of their rapid antigen kit and saliva tubes. So on a Monday and a Tuesday, or a Monday and a Thursday, apologies, a Monday and a Thursday morning each week, they do these 2 tests, and then they come in between 9 to 11 to drop off their samples. But basically, in terms of the rapid antigen test, when they do it, the test, it's a self-test at home, so you get an answer. The result comes up within in about 15 minutes or so. So you know, kind of straight away at the start of the day, then your answer to that test. The saliva test that has to be dropped off at a certain designated drop-off points around the campus, that then gets collected by lab staff, who bring that to the lab then to do a saliva PCR test. It's similar to the nasopharyngeal, but it's on the saliva in terms of what they do in the lab. And then that result then gets communicated to the student within about 24 hours. So, but I would try and reassure students, look, don't be afraid of either of these tests, and in particular, don't be afraid of the nasal rapid antigen test. I think a lot of students, to my experience, actually are nearly doing them themselves from pharmacies and shops already, just as part of their own kind of self-care. But if they want to see what's involved exactly, just to visit the unicov.org website. The video is up there, and it's very, very clear. There's great kind of graphical demonstrations and verbal explanation as to exactly what's involved.
Yeah, thanks. And I think that's a great explanation of the differences between them, and I suppose can give people a bit of in that sense that they won't be scared in getting involved because they have that same hesitancy. So another thing students were wondering is, we've seen that this study is happening on campus, and you mentioned that it could be brought into sort of other settings, and the data collected can be used in the future for sort of early warning and detection systems. Do you think that these, and we see as well in the UK for sort of concerts and stuff, they're in the pilot concerts, they're using sort of rapid antigen testing. Do you think sort of in the near future that we can, after the study, we might see the use of rapid antigen tests in other settings other than on campus and sort of large indoor conferences or in sort of live event sector?
Yeah, and I guess that's the whole purpose of it, is to try and give that information to the powers that be, to the Department of Health, to the Department of Higher Education, to the government and the cabinet, to whom like this will be fed back to government. They are involved. The Departments of Higher Education, Department of Health are involved in this project in the background, and they will be receiving the results of this. So that's why it is so important, because it could feed into either of these tests being used in other settings for events as part of just general society, maybe into the months and years ahead. So there, like I said, it is, it's, again, it just emphasizes the importance of it, that you can really kind of contribute to making a mark on how quickly we get back to kind of a safer society. And these tests, most definitely could become part of pre-testing for events, and be it social events, be it music events, whatever entertainment events, that sporting events that we might attend maybe in the years ahead.
Absolutely, and I think that's a real motivational factor for students, that their involvement in the study could possibly lead to the safe sort of reopening and continued reopening, possibly of the live event sector and social events and that sort of thing. So That's another great reason maybe to get involved. With regards to sort of COVID on campus, there were a few questions sent in with regard to that as well. One of the questions was that we read a lot about the breakthrough infections, and I suppose we can see as well that there's a very high level of vaccination, thankfully, amongst students and the general population. With regard to the breakthrough infections, is there anything that students can do, or if anything, to help prevent this?
Yeah, so unfortunately, we are even here. We've had a couple of cases in the last kind of month or so in students who are fully vaccinated. Now, again, thankfully, that's the benefit. I have to say, like from our experience, most students have been excellent in their uptake of the vaccine. So the attitude and the buy-in to taking up the offer of the vaccine has been absolutely superb across the student population. And then unfortunately, just as like I said, and it's as with the general population, you know, as restrictions have eased, so people are out getting back to kind of more normal life, that unfortunately, the COVID is still circulating, and circulating, you know, quite readily, you know, in fairly high numbers, but stable numbers over the last maybe month or so. And we are seeing some students that get it, and again, like thankfully they're not that unwell, and not needing to maybe attend hospital or that. But it still is important to detect it, so that we minimize the spread amongst the community, because there are elements that we still don't know the long-term effects of COVID, even in as a mild illness among young people. So yeah, I mean the key things in terms of, so we're still quite keen to, if we can, keep the level of COVID in the community to an absolute minimum. So vaccination is part of that, and as I say, students have been excellent in doing that. But still sticking to, you know, the hand hygiene is key, and it's not just for COVID, it's for any infection. So it's kind of keeping these clean and away from there. So I would have to admit that just on a personal level, not in terms of on the campus setting, but just out amongst the community, and this is just the general population, I think there is a bit of laxity in terms of people going in and out of shops and maybe not stopping. It takes, you know, a couple of seconds to stop, and you can be sanitizing as you go for the 20 seconds. That's a real key. Hand hygiene is actually the number one thing in terms of keeping us protected against COVID. The next most important thing is when we are in indoor situations where masks are mandatory, that we wear them. And then the key thing for me is that the next most important thing really in terms of us minimizing the spread of COVID is increased awareness and adherence to the guidance around symptoms, if you get symptoms. So though people would have been well aware of the well-advertised symptoms, the original symptoms of cough, shortness of breath, fever, or change to taste or smell, as COVID has evolved with the UK variant and then the Delta variant, and we would definitely have seen it with the UK one at the beginning of the year here in Ireland and amongst the student population, and the Delta one now, that the symptom profile has changed and has always been a little bit different in the younger population. So we would have seen maybe a little bit of cough, very little shortness of breath, a little bit of fever, and a very small amount of maybe change to taste or smell as being presenting symptoms. The predominant symptom we would have come across here, and we diagnosed over 300 cases in the student population, just in the student health unit ourselves, not from, that's only, never mind the public health contact tracing that would have gone on. But the predominant symptom was sore throat at that time, particularly earlier in the year, sore throat and runny nose, or some people would even say a scratchy throat. And then we were getting, some people might only have had a headache, or some people would have had, we had a couple of cases, a handful of cases where it was just diarrhea, nothing else that they had. And that is a recognized symptom of COVID. I think with more recently, we would have seen with this Delta variant in circulation, there seems to be a lot more maybe the runny nose congestion or sinus congestion. Again, still a bit of sore throat on the go. So I guess the key point is that if you get any symptom now, whether you are vaccinated or not, your first thought has to be, this could be COVID. And though I fully appreciate that people say, look, it probably isn't. And again, based on the positivity rate amongst testing, you're probably 97% right that this is most likely a non-COVID viral illness. It is still important that we make sure you're not one of the 3%. And that is really important in terms of us getting back to normal life. We need to pick this thing up, shut down the spread. And so the key thing for me is that, yes, hand hygiene, wear the masks where you need to, still try and keep your social contacts to a minimum if you can. But if you develop any sort of a symptom of a head cold or a diarrhea or a headache or anything like that, you're feeling very jaded, just think, could this be COVID? The access to testing is absolutely fantastic now. You can self-refer through the online portal. It's free. You can self-refer through the online portal, or if you're in any doubt or if you're feeling very unwell, you can contact the student health unit here and we can refer you. The on-campus test centre run by the HSE is now reopened. It's open from Monday to Friday, 10 to 4 by appointment only. So either you self-refer or that the GP or the student health will refer you, but it's open Monday, Friday, 10 to 4. There is another test centre, again, appointment only in Foster Street in Galway City, or if there are students in the county area, the Galway Airport test centre. So you have 3 test centres in Galway. You will get an appointment within a couple of hours and you will get a result texted to your phone in less than 24 hours. So if you're in any doubt, just like I said, sit tight, self-isolate, go about getting, self-referring a test, contacting GP or student health, get a test, get a result. At least once you get a negative result then from the HSE PCR test, that's reassuring, and the illness can be managed as a non-COVID illness. But key thing is rule COVID out first, everything else after.
Absolutely, yeah. And it's great we have those test centres on campus and the one in Foster Street, and so yeah, like you're saying, and I know it happens, you get a little tickle in the throat and you think, oh God, it could be COVID. But if you are presenting with these symptoms, it's great that we have those test centres there, and you can get, like you said, in 24 hours. Yeah, you'd miss maybe a day on campus, but it's important for sort of keeping each other safe, and even I know some of my people that I know on campus have had to get the test, and you miss a day, but we all have that responsibility to keep each other safe, and especially when we have such good services there and you can get the test result back so quickly.
Yeah, and I think in fairness, like you've just said, the key thing is that's what the college wants you to do, and the college will be understanding. The lecturers, your school, your faculty will be understanding. Absolutely. Because it's all about keeping one another safe. So there's nobody going to give out to you. Like if you say, oh, I've got some symptoms, I need to get a COVID test, I'll have a result tomorrow. That is totally accepted. It's actually we're finding it quite rare that people are needing certs. Some people are asking for certs, and we'll happily provide medical certs for anyone who's going for a COVID test and needs to self-isolate or kind of avoid people for a couple of days. But that's hugely encouraged by the university because you're playing your part in keeping everyone safe.
Yeah, absolutely, and I suppose it's great that the university are really understanding of that, given the sort of the current situation. But I think I think we covered a lot there in terms of the questions that have been brought in from students. In terms of any sort of, we mentioned how if students were looking to get involved, the sort of benefits of getting involved, and I think from my perspective as a student, it's great we have your input as a GP, but I think from my perspective as a student, it looks like it's a study that we can really make a difference in terms of the next couple of years, in terms of, like you said, this isn't going to go away in the next couple of months. This is going to be something we're going to have to live with. And I suppose as a student, we've had the last year and a half gone with restrictions and stuff not being able to be on campus, and we're really lucky at the moment to be able to be back on campus. So I suppose from my view of this study is that to get involved in this is sort of possibly paving the way to keeping us opened and keeping other sectors of society reopened. So I really think it is a great study to be involved in, and I would encourage any student that's maybe thinking of getting involved to go onto the unicov.org website and have a look there, read through join the study NUI Galway, and they have information there on how we can get involved. And I suppose it's been great talking to you, Dr. MacDonncha, and all the information you can provide here to students that are thinking of getting involved, and sort of important public health information as well about you know, the symptoms and everything, and how students can go about getting tested. So I suppose, did you have
I
any?
just want to flag, yeah, just in terms of, like, you made a really valid point there. Like, this is, none of us want to go back to what we've experienced in the last year and a half. And I think in terms of the students themselves and the staff who want to get involved, they're going to be helping themselves in terms of making sure we kind of keep moving forward in a positive way, in terms of getting back to normal life, both on and off campus. And you're playing your part, because the students know what it's been like for the last year and a half and how difficult it's been trying to deal with college remotely and have limited social interaction. So your participation in this is working towards having a safe, sustainable, open campus, edging us back to really proper kind of normal life, and making sure that students that are coming after you don't ever have to go through what you guys went through over the last year and a half. And I think I probably want to just take the opportunity as well, just to kind of highlight that the HSE will be coming on campus over the coming weeks. Starting from Tuesday of next week, they're going to be for at least 3 weeks, 3 days a week for the next 3 weeks, from Tuesday the 28th. So it'll be Tuesday, Wednesdays and Thursdays for the next 3 weeks from 9 to 5. They'll be running a walk-in kind of a catch-up vaccination clinic on campus, which is free for students, staff, or even passers-by in the public to access. And as I say, whether you've had, even if you had one dose of any of the vaccines that are out there in the past and you haven't had an opportunity to get a second dose yet, or you're waiting a second dose, you can pop into this HSE run kind of a pop-up, mop-up vaccination clinic that's going to be open Tuesdays to Thursdays, 9 to 5, starting on Tuesday the 28th of September. It'll be based in the concourse, in the centre of the concourse in the unit there. It'll be running for 3 weeks, and possibly maybe a week or two longer, depending on the band. But highly encourage any students. I know, as I said, the vast majority have had it, but if there's any student that is still outstanding in terms of a second dose or hasn't got any dose yet, and is wondering or thinking about it, just encourage them that they can pop into those walk-in clinics in the coming 3 weeks.
Yeah, and yeah, that's a great opportunity for students, and the fact that it's on campus and sort of easily accessible for students is great for anyone out there that mightn't be fully vaccinated yet. Dr. MacDonncha, it's been great to talk to you this evening. I suppose it was great that you're able to answer all these different questions that were sent in by students, and hopefully a few students will feel inspired maybe to join up with the UniCov project, which and the study, which I think will really prove to be sort of something that will be testament to the next couple of years with us dealing with this virus, as you said. I suppose, do you have any final comments for students who are thinking of getting involved? You mentioned paving the way for people coming up behind them that they won't have to go through the same situation as last year. But any final comments?
Yeah, no, just thanks yourselves for the opportunity just to kind of speak about it and try to kind of shed a bit of light on it and maybe dispel any myths and kind of allay any fears that students may have. And yeah, like I said, just even if you're kind of half thinking about, just visit the website. The website. There's loads of information on the webpage, unicov.org. Watch the video in terms of what's involved in the testing. And really all I just say is join. The more people that join, the more effective the study will be. The more people that join, the safer a campus we're going to have over the coming semester and academic year, because more people are going to be testing. So it kind of spreads it widens the net in terms of us hopefully picking up more asymptomatic and pre-symptomatic COVID during the course of the semester. So just that'll be my final parting word. Join.
Yeah, exactly. Join. Thanks, Dr. MacDonncha. Thanks for taking the time out of your day. I know you're very busy there in the health unit all the time, so we do really appreciate you taking your time out of your day to answer some of these questions. And I think it's been a really informative sort of Q&A session. So thanks very much for that. And thanks to Danielle Nicholson, the communications manager at UniCov, and to Cormac Staunton for organising this. It's been great to be able to talk to you, Dr. MacDonncha. And yeah, as you said, join, and students can get more information on the UniCov website, unicov.org. Thanks a million, Dr. MacDonncha. Thanks for your time.
Thanks, Jack. Thank you.